In this video, I'm going to show you how to fabricate the hand-based thumb opponens orthosis. We're making this out of Orfit Classic Microperf. As you can see, if you plan ahead, you can get 12 of these out of a single 18 by 24 inch sheet. We're using the 1/12 inch thick, and it's sometimes known as the Orfit Classic Soft. You can cut these apart with a all-purpose snips, or if you prefer, you can use a utility knife to cut between them, and then it snaps apart pretty easily. First, you're going to put it in the hot water tank, and you want it in there just for maybe 10-15 seconds, just enough to get soft so you can cut it, but not so much that it gets totally floppy. So here it's getting a little flexible and it's soft enough to cut. Orfit will stick to itself if it gets folded over on itself, so you want to avoid that. Another way to help with that is to put some sort of clear dish soap in your splint pan. So I'm just cutting out the basic shape here. So as I'm cutting the pattern out here, you can see that this pattern or the shape is a little abstract. And I like to compare this to a pair of pants, because that gives terminology then that I can use when I'm teaching students how to refer to it. So if you think of this, again, as a pair of pants, you have at the top, you'll have the waistline, so right along here, a waist. Here you'll have hips of the pants. Then you have the two legs along with two toes in the pants. And then between the two legs you have a crotch. And that will help us to, as we make this on our client, to have terminology to refer to it. So this goes pretty quick. We've reheated our material in the orthosis warmer, and I'm going to put it on my client, who right now is in a neutral prose soup with a thumb up in the air. You're going to take the waist and line it right up at the IP crease of the thumb. Take the hips around the back of the thumb and stretch the material out a little bit and pinch right next to the thumb there. Then you're going to take the crotch and just roll it up in the thumb web spice. Once you've done that, you're going to position the person's hand in opposition, but not have them, touching or pinching, but just have them positioned in opposition. And then you take the toes and you pinch those together on the ulnar side of the hand. Once you've done that, you can also grab their distal phalanx and push a little proximally to get the thumb MCP joint at 30 degrees of flexion. That's one of the critical things, is you want that MCP joint at 30 degrees of flexion, because that will help to stabilize the CMC joint then when they go to pinch. After a minute or so, this has cooled off enough that you can pop loose the two toes from each other on the ulnar side of the hand, and then pull the orthosis off the thumb. If you have any trouble getting it off the thumb, you can put your other thumb on the person's thenar eminence and kind of push on that or pull it proximally so their skin doesn't bunch up as you pull it off. I'm going to cut the hips off, and I cut that fairly close. We'll make that seam permanent in a little bit. Then I'm going to cut off the extra parts of the toes where those were bonded together temporarily around the ulnar side of the hand. I like to keep the curve around the ulnar side of the hand in the leg that goes around the palm. I think that helps give it some stability. Now that I have my shape, I'm just going to kind of check it again here and see how things fit. And it looks like, we're doing pretty good at this point. So I'm going to take this off and start working on my edges and that sort of a thing. Again, pulling the skin proximally and the thenar will help orthosis that's a little snug to come off easier. So I'm just going to snip off any pointy parts, and I'm going to make that seam where I cut the hips off permanent. To make that seam into a permanent bond, I'm going to use a heat gun on the seam, which right now is more or less temporarily bonded from being cut with the scissors. So I just go with the heat gun right on the seam, just getting the edges of that seam a little transparent. That's one of the nice things about the Orfit, is it does become transparent or translucent when it gets warm. You want to be careful that you don't get the orthosis so warm that it starts to lose its shape. Orfit does have almost perfect memory, so where you've stretched it, if you get that part too warm, it'll shrink back to its original size and shape. So you want to be careful about that. In order to make that seam permanent, I'm just using the dry heat from the heat gun, and the technique I use here is once I've heated it up just a little bit, you can see it's heated only for a few seconds. I support it inside, and then with my other hand I pinch that material together really good, and then once I've pinched it together, might heat it again for 2 or 3 seconds, and then I'm going to kind of fold that material over or kind of moosh it down so the two sides that come together at that seam are really indistinguishable. You shouldn't be able to see a line where those two sides have come together. So here I'm just going over it another time, making sure that that seam is flat both on the outside and inside. You notice I keep fingers on the inside of the orthosis as I do this so I don't lose my shape. Once you've worked that seam enough, the two pieces of plastic where they come together, you really shouldn't be able to distinguish a seam there or a line at all where one piece starts and the other piece ends. It should just appear to be all one piece and look something like this. So next we're going to work on the thumb hole a little bit. If the thumb hole is a little snug, this is a time that you can enlarge it just a little bit. What I'm doing here is simply flaring the thumb hole a little bit so that there's not an edge rubbing when the client bends her IP joint. So I'm just kind of going around, flaring, rolling it back just a little bit so that, again, there's good thumb IP joint movement with this. You'll notice when I do dip the orthosis in the tank to warm it up, to work on it, I only dip it for a few seconds. Any more than that and you're going to lose your shape. So when I dip it in there, it's about 6 or 7 seconds, and that's typically enough to make it soft enough to work with. I like to do the thumb hole in the hot water, but the other edges of the orthosis I tend to like to use a heat gun for with this material. And you can see I'm kind of have the heat gun in my hand and the splint in my other hand. That way I can get the heat just exactly where I want it. And I heat by aiming the heat gun right on the edge. There I get some good heat on the edge so I can work on the edge a little bit. But the heat is not against the side or the surface of the orthosis, so I'm less likely to actually lose the shape of my orthosis doing this. And once I've heated up, you can see I just take my thumb or my finger and fairly gently just roll or flare it back a little bit, just enough so that there's not an edge there that's going to bother the client. Probably on this orthosis, the edge that will be most frequently bothersome is the proximal edge on the dorsal side, and so that edge may require some more attention depending on your client. So at this point I'm going to check the fit on my client, check the fit of the thumb hole, make sure that the thumb hole allows full IP motion. At this point you really also should be checking for wrist flexion and extension, and that is not bothersome for your client. Here I'm cutting the self-adhesive or sticky back Velcro hook to put on my orthosis. I'll put one tab about 1.5 inches to 2 inches long on each leg of the orthosis, both palmar and dorsal. Oftentimes on the dorsal side, that leg ends up being a little narrower because you have to trim it to clear for wrist extension, and so then I'll cut the Velcro hook also a little narrower to fit on the orthosis material that I have. To get the Velcro to adhere permanently to the orthosis, it really helps to use the heat gun to heat up the sticky back of the Velcro, and also to heat up the surface of the orthosis just enough to get it shiny, and then you can apply that sticky back on the orthosis and work it in there a little bit, and with a little bit of pressure and sliding it around a little bit, that will become quite a permanent bond and will last a year or more. If you forego this step and just stick the Velcro on, it likely will come off within a week or so. Use a scissors to hold the Velcro up to the heat gun. Don't try to do this with your fingers. If you do try to do it with your fingers, you will find out why that's not such a good idea. But again, heat the sticky back of the Velcro on the heat gun, heat up the surface of the orthosis just till it's shiny, and then work the two together well, and that will form quite a permanent bond. For the strapping for this orthosis, I just use plain old Velcro loop material without any adhesive or anything fancier than that. I don't use any padded strapping. Just the plain old Velcro loop will work quite nicely. It won't irritate because it's just covering 1 inch or so on the ulnar border of the hand, and it lasts, again, a very long time, several months, rather than using a padded strap that would likely start to disintegrate before that. I like to round the corners of my strapping as well. You certainly want to round the corners of the self-adhesive Velcro hook to make that stay on better. I also round the corners of the loop strapping. I think it just looks a little bit better that way. Now here I'm checking for, does the orthosis allow for full wrist flexion and extension? Flexion side, it seems pretty good. On the extension side here, you can see that it is kind of digging into her dorsum of her wrist a little bit there. Really should have dealt with that prior when I was checking the fit of the orthosis. But now I've trimmed some of that material off and then flared it again, and now it's working quite a bit better for her. And that is what the finished product looks like. Thanks for watching.